You guys, welcome back. I'm going to jump right into chapter 26, microbial diseases of the nervous system. We'll be covering meningococcal meningitis, botulism, leprosy, polio, rabies, and we'll be answering these specific questions. Number 40, identify the causative agent and its distinctive morphology. We'll be talking about the characteristic symptoms, the major virulence factors, explain the role of healthy carriers, and the best method for preventing disease. Meningococcal, so I'm just going to show you a quick way I organize this. We have the microbe. The disease will be all on the left here, but we'll have the microbe, the causative agent, the form of transmission, the signs and symptoms, the virulence, the preventative measures, and a little bit of epidemiology, if there is any that's pointed out, and any side notes that I think is important. Meningococcal meningitis is a microbe, which is a bacteria, of course, and the causative agent is Neisseria meningitidis, which is a gram-negative bacteria. The transmission route is, actually, I don't think I have the transmission route on here, but something that's important about the transmission route is that 40% of, there are 40% of health, there's about, okay, sorry, I'm messing up my words, and I was just doing so good. So healthy carriers account for 40%. So, and it's kind of scary because if there are healthy carriers that are around, that 40% of them are healthy carriers on a college campus, for example, that's kind of scary because that's an easy way to transmit it. Try and get to the doctor if you know a friend and all of a sudden they come up, they say all of a sudden they kind of develop a rapid onset fever, they have a headache, or they have a stiff neck or a rash. These are the main characteristic signs and symptoms that say you need to get to the hospital quick. And if you don't, I'm just going to rush to this quick, it's 100% mortality rate. And that's why it's really important to get to a hospital right away when it comes to meningococcal meningitis. I've had a friend who had an experience with this with a roommate and actually saved his life. So that's why I know a little bit background behind that. So stiff neck and rash, that's your main, like if it comes up on the quiz, stiff neck and rash, that's a huge clue that, and rapid onset fever, that's going to be a huge clue that that's the disease that the professor is trying to get you to see. Virulence. Virulence. Endotoxin attach, as she said in here. Let's see where she said. Did she say it in here? Oh, yes, its ability to attach and the endotoxin. So when it comes to the virulence factors, the endotoxin attach. So the virulence factors are, it's an endotoxin, it attaches, and septic shock is also on there. The top two are the main one, but this was from the slide. So she makes a quiz question and she happens to have septic shock on there, and it's like choose all of the following that are associated with the virulence factors for meningococcal meningitis, then you'll know that septic shock, endotoxin, and attachment is part of its virulence factors. Prevention. There is a vaccine for college students, and they suggest that all college students get it. Also, from 11 to 12 with a booster at 16. This was on the slide. There is no vaccine for listeria. So when it comes to listeria, yeah, there's no vaccine for that, which is pretty scary, but that's where we're at. The epidemiology. So meningococcal meningitis is an epidemic causer, right? If it's in a small area, there'll be an outbreak and it can cause an epidemic. Here are some side notes. Basically, symptoms can lead, the way the disease will progress is an individual will have convulsions, then a coma, and then it'll eventually lead to death. And again, if it's untreated, it's 100% mortality. Treatment. Pretty much You could do a gram stain of CSF, is cerebral spinal fluid, and antibiotic treatment is done immediately. So that's why I say ASAP. That's why that would have to, as soon as that onset fever and the stiff neck starts to occur, then you want to get the person to the hospital right away. Let's move on to botulism. Remember in my previous video, I told you that botulism, I'll just show you this real quick, that botulism is the most powerful toxin in the world. Yes, it is the same thing that people are using injecting in their face, Botox. So that's one way that you can remember it, because it causes paralysis to help people prevent wrinkles. So that's why people use it kind of aesthetically. So anyway, let's get back to it. Botulism is the causative agent is Clostridium botox, which is an anaerobic spore former. And remember, it can secrete a toxin. So we have three types. We have food ingestion, which is the most common. We have infant botulinum, which, remember the picture of the baby, they called it floppy baby syndrome, which is really sad. But this infant botulinum causes the floppy baby syndrome. But remember, this food ingestion causes a toxin, whereas the infant botulism is an infection, because the Clostridium botulinum is growing in the intestines of the baby. So, and then finally we have wound botulism, which is or let me see if I can remember. Oh, that's like if there was toxin that got into the wounds, if it wasn't cleaned very well, then that's how you can get wound botulism. I think we're all aware of this one with the canned foods, but this one can be kind of maybe possibly, probably testable, the wound and the infant botulism, because I didn't know about these two. And the fact is, the reason why I made that a B is because of that. It is bacterial in nature for the harm of the individual, whereas ingestion and the wound is actually associated with a toxin. Moving on, the signs and symptoms. You have a flaccid facial paralysis, so the face kind of looks like kind of tired, or how do you say? It's more or less paralyzed. So it's difficult to diagnose just by looking at the signs and symptoms. A person could just look like tired or exhausted because their face is paralyzed. The flaccid facial paralysis, that's specifically from the lecture slides. And then also respiratory failure. The virulence factors is, so here's the thing about the virulence factors with botulism, or Clostridium botulinum. The vegetative cells will produce the most toxic compound ever. As you remember, she had a picture of like a funeral, a whole bunch of people, it was like 12 people had a meal and all of them died. It was 100% mortality because of how powerful the toxin is. And that's the part of its virulence factor, maybe one of the strongest virulence factors for botulism. When it comes to prevention and a vaccine, basically for prevention, it's food poisoning in terms of proper canning, and they use nitrates because of the trying to get rid of those spores or try to help them not to germinate. Then you have for wound botulism, you should properly clean wounds. And then when it comes to infant botulism, you should avoid foods with spores. So I just became an aunt, and my niece is so cute, and I reached out to my brother because I'm sure the baby is very young, so she's still getting breast milk, which she's building her antibodies, she's building her immunity, so she's getting her antibodies from the mom. And I say all that to say that I let him know that, like, if when she does start eating, not to give my niece honey, because of the fact that there are some foods with spores and honey is one of them, and I wouldn't want her to go through infant botulism and get that syndrome. So yeah, maybe that's a way to help you remember those three different types of botulism. Sometimes when you associate it with a story or something close to you, it makes you remember it long term. What else? Okay, also about the pathogenesis for botulism, the fact that it blocks the neurotransmitter release and causes paralysis. So that's how it does its dirt. It blocks neurotransmitter release and it will cause paralysis. And let's see here. What did I say about this one? 70% fatal if untreated. Is this might be another slide. I'm going to double check what the 70% is for. But when it comes to treatment, the treatment is an antitoxin and respiratory support. So those are the treatments for botulism. I'm just gonna look really quick. Fatal untreated. I gotta figure out what percentage this is for. Oh, okay. This was the difference. Okay, I told you that meningococcal meningitis, the causative, sorry, Neisseria meningitidis, the gram-negative causative agent of meningococcal meningitis, is 100% leads to 100% mortality if untreated. Well, when it comes to botulism, there's a 70% chance of fatality if it's untreated. So there's that. Okay, moving on. Sorry if I went into too much detail, but I just wanted to make sure I didn't miss anything. Let us look at, okay, we're now on chapter 26 and we're looking at leprosy. Leprosy. Yes, we're leprosy. Okay. Identify the causative agent. List its virulence factors. Contrast the two forms of leprosy in terms of the effectiveness of the immune response. And explain how leprosy is transmitted and whether it's very contagious or not. Leprosy, or better known as Hansen's disease, that's how they're calling it now. But leprosy is a bacteria that's caused by M. leprae or Mycobacterial leprae. This causative agent prefers cool temperature. It grows in human extremities and in the foot pads of mice and armadillos. So I don't know if you remember that picture that she posted of that armadillo. I know I can't get the fact that those cute little things carry Mycobacterium leprae, which now I think is gross. So there you go, microbiology. So the transmission route is direct. However, leprosy, which is kind of when you think about like all the leper colonies that they had, where they separated people with leprosy away from everyone else, you find out that it's not even very contagious, but it is through direct contact. So if you're in constant contact with people, then yeah, with people with leprosy, then yeah, you could probably get it. But I didn't realize that it was not very contagious. So the signs and symptoms or actually, I don't know if this is under valence factors, but you'll see tissue damage and nerve activity loss. So those are two huge things that are associated with leprosy. What else? I think I put this, yes. So what is the prevention? The prevention is the treatment is an antibiotic that is actually effective, but the point is that it's slow. You would have to be on the antibiotic treatment for 6 months to 2 years. And the reason is due to the fact that Mycobacterium have that very strong mycolic acid, which is the virulence factor for leprosy. And we know that Mycobacterium or acid fast bacteria have very slow growing kind of log phase. And so because it takes so long it takes even longer to treat the disease with the antibiotic. It's effective, but it just takes a long time, which would mean that probably maybe people don't comply with treatment because it's so long, but compliance is probably an issue with that. So I don't know if she'll have a question about compliance. Going on, we have the two separate types of this disease. TB, TB, leprosy is pretty much good cell. It's well cell mediated, and there's very few bacteria. Whereas the leprotimus type, which is the second type, is that there's a cell mediated defect, and that there's a high amount of bacteria, and that pathogenesis is that gosh darn that cell wall that is just really strong, and the mycolic acid as well. It's cell-mediated immune response pretty much what causes nerve damage, and that's a huge part of the virulence factor as well. So I think if you remember all these things, the fact that TB it's got good cell-mediated, but because it's got few bacteria, the leprotimus version of leprosy is cell-mediated defect, which is not good, and then you have a high amount of bacteria. And then you have, in terms of, for both of them, the cell-mediated immune response causes nerve damage. So there you are. Polio. Polio is a disease that is a virus, and it's caused by poliovirus. Am I still working with the same stuff? Yes. It's caused by poliovirus. The transmission is fecal oral, which is as disgusting as it sounds, but that's polio. And then you have the fact that the way in which they affect people. So most people are asymptomatic if they have polio. Infants, it's actually very mild, which is not like botulism when it comes to infant botulism. So the infants, when they are exposed to polio, it's mild, whereas when it comes to teens and young adults, they have a high risk of getting the paralytic version. So it's high risk, and they are more likely to get the paralytic version. And you can Google a quick picture of polio if you want to see what that looks like. When it comes to the vaccines, right? Polio is associated with, we all know about the polio vaccine, but I didn't know about the two types. We have the Salk, which is I put dead, but it's just for me to kind of make this short. Attenuated whole agent, inactivated whole agent, which means dead whole agent of the virus. So the virus is inactivated, it won't work. But it's not as effective. But I put this developed here. It's effective, but I put this developed here because in developed countries such as the United States, we use the Salk vaccine. But in places where polio is endemic, it's necessary to use the developing Sabin vaccine. And it's oral, live, attenuated, right? That means it's a live vaccine. And honestly, only 1% to 2% of the thing that's kind of, that would scare people is that the fact that it has a chance to revert. It can revert, but that's only 1% or 2% chance of reverting. And the Sabin vaccine actually gives mucosal immunity, whereas the Salk vaccine doesn't. So, yes, that's what the slide said, and that's what I'm going with. And she gave us the example of Israel where it was endemic, then numbers declined, then they were using the Sabin vaccine, then there was an outbreak. Sorry, and then they switched to Salk, then there was an outbreak, then they had to switch back to Sabin because of the fact that Sabin is more effective. What else? The pathogenesis. So 2% replicate to motor neurons. So I think what I wanted to say here was the fact that I think the replication occurs in motor neurons. What I can do is just double check and look this fact up while you're here, if you don't mind. I'll just scroll and find that really quick. Okay. Here's the pathogenesis that I was trying to read. So, in 1 to 2% of cases of the virus replicates in motor neurons. So, that's what I meant to say. So, the pathogenesis can cause muscle paralysis. So, I'm just going to add that really quick because that's kind of really important. So, when it comes to the pathogenesis, I think I was just getting tired and I didn't add that. So, about 2% will replicate in the motor neurons, and it can cause muscle paralysis. Don't get this paralysis confused with, geez, the way I spell paralysis is deplorable. Paralysis. So when it comes to pathogenesis associated with polio is that it can 2% replicate in the motor neurons and can cause muscle paralysis. Last question, and I believe I answered all the questions here because the question was, let's see, how is the virus transmitted? Polio, and I told you that it was fecal oral route. And then, what is that? Oh, explain what population is most at risk for paralytic polio and how often this occurs. And I told you that paralytic polio is associated with young adults and teens have a higher risk. And yes, they have a higher risk of getting that. And then contrast the two vaccines based on composition, risk, and benefits. So, like I told you, whereas in developing countries, you will use the Sabin vaccination because it's more effective. It is an oral live attenuated that increases the mucosal immunity and can unfortunately revert, but it's a very low chance. So that is the benefits of it. Okay, last question. Damn, this is a long video. Um, Rabies. Explain how the virus is transmitted, direct contact, which that already answers the question. I don't even think I put that up there. And the most common reservoir in the US versus the developing world. Rabies. So the question that she posted was, what is the, you know what? I think I actually got this one wrong. So it's so funny because she put how it's transmitted. And I think I put in my transmission that it's a zoonosis. So don't make my mistake. But at the end of the day, that is the reservoir and the transmission is direct. So I'm just gonna change that really quick. And it makes sense too. And the reason why it makes sense is because if you come in contact with an animal, right, you have to come into direct contact with them. So that's my correction. Right. Or exposure to your mucous membrane. So remember, you can either get a scratch or a bite, but then she told us the story of the young boy who passed because there was a little bat that was just flopping around in the house, and unfortunately, it exposed the rabies virus to the boy, and he unfortunately passed. What else for questions? So let's see here. Oh, so the next question is the most common reservoir in the US versus the developing world. The most common reservoir in the U.S. versus the in the U.S. versus worldwide is, let's see, where do I have this written? Where do I have this written? I have it written here small. Okay. Essentially, right, rabies is very low. It doesn't happen very often in the United States, so I put low, right? Excuse me. When it comes to the U.S., it's actually bats as the reservoirs. They're the most common reservoirs in the United States, whereas worldwide, it's a large percentage, like I think she said 70K, of 70,000 cases is because of dogs biting little children, which is really, really unfortunate. But in terms of the difference in reservoirs, they are both animal or zoonotic reservoirs, but in the US it's bats, and in the United States it's dogs. So you won't get that ferocious there's a lower chance of this ferocious dog biting you in the United States, because we do a lot of vaccinations for our dogs and we do all those types of things. So that's the difference. Her next question is, describe how rabies is diagnosed in an infected animal. Oh, I actually didn't write this down. I did not actually write this one down, but if I can remember properly, unfortunately, the animal has to be the animal actually has to be unfortunately killed in order to verify that the virus is in the the animal. So what I'm going to do is just pull this up really quick, because I remember her talking about this specifically, but I'll answer the next question and I'll run back to that. So let me see here. And you can zoom past if and zoom past to the question. So define post-exposure prophylaxis. Okay, so say someone gets bit and now they've been exposed to rabies virus. Well, what they can do, fortunately, is they have PEP, which is the post-exposure prophylaxis. Prophylaxis, if you don't know what it means, it's just kind of like a synonym for like prevention. For example, like when somebody uses condoms, they're using a prophylaxis if they're trying to like avoid not wanting to be pregnant or trying to avoid STIs, they would use condoms, and that's a type of prophylaxis. Birth control is a type of prophylaxis. So there's all these prophylaxis out there. It's essentially prevention. So hopefully that clears that up. But PEP, which is post-exposure prophylaxis, is a killed virus, or you could say inactivated, and it is you pretty much would be injected with passive immunization. It's kind of like kind of like a vaccination, but usually we think of vaccinations as prior to the exposure. But this one is afterwards, and that's why they call it passive that's the word, immunization. It's passive immunization with the antibody. So that's what PEP is. But the only way this can work is if you are bitten and it's after the exposure immediately, but before the symptoms. So if the symptoms start, look, there's no way to, if the symptoms start, that pretty much means that you're dead. Just as in, this was just like which other one? I think it's, yeah, just with meningitis, if the symptoms start, that's more or less, that's it. Whereas with, when it comes to rabies, if the symptoms start, it's fatal. It's pretty much fatal. And there's, until 218. I'm going to look really quick on what she said about this question right here, which is describe how rabies is diagnosed. And then, looking for you. Okay, one sec. Ah, okay. I've got the answer. Sorry about that. Sorry it took so long. Okay, so essentially, rabies, remember, is basically you'd be doing a kind of a test, and they would essentially look for negri bodies in the brain tissue. And so they would have to do an autopsy, which will unfortunately kill the animals. So they'll be looking for specifically these negri bodies, which if I drew this, there's actually a picture online, but maybe I could just search one really quick. Negri bodies on an autopsy. Aha, this is a perfect picture. Or I should say perfect pictures. So these are pictures of negri bodies. And so these, I think this is the one that we had in our, oh, perfect. It says rabies victim showing negri body. So, so this is a picture of what, this is essentially what they'd be looking for in the slide. But this is, of course, after an autopsy, and it would essentially sacrifice the whatchamacallit, the animal. What I should probably hint on, this wasn't inside of the slide, but if you look, it says, okay, so rabies is a virus, virus. The way it can be diagnosed is in negri bodies, which unfortunately the animal would be killed. And the transmission is either direct or the exposure and the mucus. Or it'd be exposure to mucous membranes. And unfortunately, the behavior will spread the virus to other, as much as it possibly can to continue to replicate. The thing that I was trying to get to is the fact that I guess I was surprised. Like, I thought you would get bite and then all of a sudden become this like rabid, ridiculous thing, or the animal would become this rabid, ridiculous type of, thing that's associated, behavior that's associated with rabies. But I guess the incubation is very long. The incubation is very long, and it starts with general symptoms, and then it starts to progress to agitation, and then the individual won't be able to swallow. They'll have muscle spasms. And then that turns into a coma, and then death. And so the two types that you would see is the restless, excitable dog. And I don't mean excitable in a good way. That's the restless, excitable dog that is angry and is rabid and has got the how do you say, the what is it called? It's got foaming at the mouth and angry and rabid. Whereas the alternative is if this is the ferocious type. The alternative type is starts with a P. Let's look at this one really quickly because I've already forgotten the name of it. The name is, what is it called? Well, this is not needed for us to answer, but it doesn't hurt to know. Just like post a question. Oh, there we go. Just rabies, restless and highly excitable. And then you have the paralytic rabies, which the animal seems aware of its surroundings. So, like I said, unaware of its surroundings, like the docile bat. It's like a sweet animal where even though it's a wild animal, it's definitely got rabies because a wild animal doesn't want to be picked up in any sense of the word. So that's it for chapter 26. I know that was a little bit long, but thanks for hanging out with me. I hope this is helpful. If you don't have much time to study tonight or tomorrow, you can take a look or listen at these lectures, and hopefully that'll help you. And I'll just put this in the entire frame. That way, if you wanted to take a look at it or ask me for pictures, I'm happy to help.